Good morning. Welcome to the OHSU Effect Inside Health and Science at OHSU. I'm Lacey Evans. We have another fascinating and educating hour for you. Later on in the show, we're going to discuss the risks between LASIK eye surgery and contacts. You don't want to miss that. But first, a topic a lot of families can identify with: parenting a child with ADHD. With us now on the OHSU Effect is Aaron Tabacco from the OHSU School of Nursing. Hi, Aaron.
Good morning.
So first, your expertise is family nursing. Explain what that means.
So family nursing is a way of practicing nursing that recognizes that the entire family is really your client or your patient, that every individual experiences health and illness in the context of their family. And so it really just makes sense to focus a lot of our care and intervention and assistance and coordination at that level with the entire family in context. So it really is just a way of practicing, researching, and theorizing about who the patient really is and how to bring things together.
Interesting. Okay, so specifically today we're talking about ADHD, which can sometimes be a confusing diagnosis for many people. Mm-hmm. So give us an overview of the most current thinking about ADHD.
Well, that's a really good question. ADHD is a term I think almost everybody seems to know and have an opinion about, but there's a lot of new knowledge that's come to light, really in the last 5 to 6 years especially, that's helped us understand a lot better what's really happening in terms of ADHD. What we're really looking at now largely is an understanding that this is a genetic disorder of the frontal lobe of our brains. So I'll get into that in just a second. But basically what we've understood is that the genetics that are responsible for these nice little communicating cells in the front part of our brain, right behind our forehead here, have difficult time communicating with each other. Couple of big $10 words there, dopamine and norepinephrine, are the two chemicals really responsible for helping those brain cells communicate in this particular area of the brain. So the reality is, at least as far as we can tell with a lot of our advanced imaging and other sciences, is that the brain with ADHD is wired a little differently, in that those cells right up at the front of our heads here have difficulty communicating with each other. And what that results in then is a change in what we call executive functioning. It's a developmental ability to have self-control and direct ourselves toward the future. So it's a very different look on this level than it was 10, 15, 20 years ago, when all we really could do was just describe symptoms. So your expertise is working with families who have children with ADHD, and it affects the entire family. So explain how that is so. So like any health condition, it's an interplay of the individual and their environment and the condition itself. And in a family dealing with a child with ADHD, they're dealing with some very, very challenging behaviors that really push families outside of their comfort zones in terms of social connectiveness and educational issues and behavioral management. And so really, when a child has difficulty developing those self-control skills, everyone in the family is affected: siblings, parents, work life, school life, social relationships. And so family nursing, again, comes to play really nicely in this, in that if we look at the whole client here as the family, we should be able to really affect a better outcome for everybody. And do you have personal experience with ADHD in your own family? Yeah, I do. And I think this is true of many, many researchers I've come to know over the years, like myself, practitioners and researchers alike, is that we usually have some sort of personal experience that drove us there. And for me, I have 3 sons from ages 15 to 9 who live with a diagnosis of ADHD. And as a consequence, we all live with that. So life is very interesting. But it was about I think about 11 years ago that I decided I need to make a major switch and focus on ADHD. And so I literally changed careers, became a researcher in ADHD, and thought nursing was the best place for me to be in order to have the effect I wanted. So wow. And so you have 3 boys with ADHD? 3 boys. It's like having 6. Well, let's talk about if you have one child with ADHD and one with not. I mean, I'm sure that can present a lot of unique challenges. It does present a lot of challenges. And there's been some research, not a whole lot, but some really, really good research actually up here at OHSU. Dr. Judy Kendall, who was here for a number of years, was really a leader in family ADHD research, also a nurse. And she did a really interesting study looking at siblings and ADHD. And it was really fascinating looking at how the parents perceived things going on and how the siblings really experienced ADHD. And there was a lot more going on than we realized. I think the challenge for parents always becomes one of balance. How do you achieve a sense of balance when you have one child whose needs are really significantly higher than the other, and not at the same time downplay the other child? And I think that's what families tend to say most often is that's where we need help, is how do we not ignore this other child? How do we protect the other child, and how do we parent consistently? I think probably the next most frequent comment from families on that topic is, well, I'm constantly disciplining and correcting and helping this one child, and they see that their sibling doesn't get that. So there's this justice issue that happens in families, and that can be really challenging.
Well, what about specialized parenting skills? Do parents come to you and asking for that a lot?
Yeah, I think actually that's probably on the top 3 list of things families need when I start working with them personally. Usually if they have a school-age child, it's tension with school. That becomes the number one issue. And then right behind that is trying to manage behavior, really helping this child to remain centered and focused and calm in a way that they're successful. And so parenting skills really becomes an important part of intervention for us. I do a lot of coaching and training myself, but there's a lot that goes beyond my own scope of practice. And so I work collaboratively with a number of psychologists and counselors in the community and physicians as well who, as a team, we try to figure out the best way to help families implement those things.
Well, a lot of times, a lot of parenting falls on the burden of the mother, but you kind of your expertise is the role of the father and how they can be active in this type of family situation. Do you want to talk about that? Yeah,
absolutely. And I think it makes sense. Obviously, as a father of ADHD, that's where I wanted to go with my own research. But what I noticed when I was working with families as a full-time clinician in their homes as a nurse on this very issue was that fathers gravitated toward me as another father, and were very often present at our family meetings and taking a very active interest. And it really started me thinking as a researcher about what was really going on there. And, I think my experiences told me that most fathers really have a lot of thinking going on here that they don't easily express and are really challenged by ADHD. It really pushes their comfort and their understanding of what it means to be a father and to be a successful father. And ADHD is challenging to all parents, fathers or mothers, because quite frankly, what tends to work for every other child doesn't really work in ADHD as frequently. And so, dads internalize that too. They often feel like, well, I'm not doing a good job. I'm not doing the right things. If I only pushed a little harder or helped in a different way. And so I've seen fathers really react in sort of a whole spectrum of responses to their children. And it's been fun, really, and enjoyable to learn how to help them with that.
Well, just about a minute and a half left,
Sure.
But I want to ask you about kind of the stigma that people think behavioral problems aren't really a disease. It's more of a social disease, if you will. So talk briefly about that.
Well, that's a really good point as well. I think that big picture, ADHD really is a problem based on your own society. In our society, the expectations are, time management, self-management, goal-oriented, autonomy, all of these kind of things that as an adult, you're supposed to achieve this goal. And ADHD challenges absolutely every single one of those. So there tends to be a whole lot of stigma that families live with, especially mothers, in feeling judged by their parenting skills and et cetera. And there's a lot of mythology that ADHD is a product of poor parenting. Actually, very interesting research has shown us it's sort of the other way around, that most parents start out really on a healthy track toward parenting and having good skills. And then guess what happens? They have this child who's developing with ADHD, and over time, the parenting skills sort of erode because nothing's working and they become very frustrated. So most of the time, it's actually the other way around.
Got it. So how can parents get in touch with you or someone at OHSU if they want help?
We have a number of options for families there. We have the Child Development and Rehabilitation Center, which is a part of Dornbecker Children's Hospital, where there's a number of child developmental specialists up there. So they can seek a referral to a child development clinic. Our general pediatrics practice also at Dornbecker has amazing clinicians and some really great folks focused on ADHD. I think that probably those are two really good places to start.
All right, Aaron Tabacco with the OHSU School of Nursing. Thank you so much.
You're welcome. Thank you.
More of the OHSU Effect next on KXL.